Question 1. The efficiency study reveals significant delays in diagnostic imaging access for patients with suspected oncological conditions, leading to prolonged patient anxiety and potential delays in treatment initiation. Dr. Anya Sharma, a practicing oncologist, is concerned about the impact on her patients and the overall effectiveness of cancer care delivery within her regional health authority. She is considering how best to address these findings. Which of the following actions best reflects a professional and effective approach to addressing the findings of the efficiency study within the Canadian healthcare context? Option A. Dr. Sharma should collaborate with hospital administration and the regional health authority to develop a proposal for process improvements, potentially involving increased staffing, optimized scheduling algorithms, or the exploration of new imaging technologies, supported by the data from the efficiency study. Option B. Dr. Sharma should focus solely on expediting imaging appointments for her own patients through personal appeals to radiologists and administrative staff, without raising broader systemic concerns. Option C. Dr. Sharma should dismiss the study's findings as a bureaucratic exercise and continue to manage her patients' care as she has been, assuming the system will eventually self-correct. Option D. Dr. Sharma should immediately contact local media outlets to highlight the study's findings and the negative impact on cancer patients, urging public pressure for immediate changes. The correct answer is A. Dr. Sharma should collaborate with hospital administration and the regional health authority to develop a proposal for process improvements, potentially involving increased staffing, optimized scheduling algorithms, or the exploration of new imaging technologies, supported by the data from the efficiency study. Explanation. This scenario presents a professional challenge due to the inherent tension between resource allocation for immediate patient care and long-term systemic improvements. The physician must balance their direct responsibility to current patients with their broader professional obligation to contribute to a more effective and equitable health system, as mandated by the Medical Council of Canada's (MCC) ethical guidelines and the principles of health policy. Careful judgment is required to navigate these competing demands without compromising patient safety or the integrity of the health system. The correct approach represents best professional practice because it acknowledges the physician's dual role as a caregiver and a contributor to health system improvement. By advocating for evidence-based changes that address the root causes of inefficiency, the physician aligns with the MCC's emphasis on professional responsibility and the pursuit of optimal patient outcomes within the Canadian healthcare context. This approach prioritizes sustainable solutions that benefit a wider patient population and contribute to the efficient use of public resources, reflecting a commitment to the public good. An incorrect approach that focuses solely on individual patient advocacy without considering systemic implications fails to address the underlying issues contributing to wait times and resource strain. This can lead to a perpetuation of the problem, impacting future patients and potentially leading to burnout for healthcare professionals. Ethically, it neglects the broader responsibility to contribute to a functional health system. Another incorrect approach that involves bypassing established channels for reporting concerns, such as direct appeals to media or political figures, without first engaging with internal hospital administration or relevant provincial health authorities, can undermine collaborative problem-solving. This can create unnecessary conflict, damage professional relationships, and may not lead to effective, sustainable solutions. It also risks misrepresenting the situation and can be seen as unprofessional conduct by the MCC. A further incorrect approach that involves ignoring the study's findings and continuing with current practices, despite evidence of inefficiency, represents a failure of professional responsibility. This inaction can lead to continued suboptimal patient care, wasted resources, and a lack of progress in improving the health system. It directly contradicts the MCC's expectation that physicians actively contribute to the advancement of healthcare. The professional decision-making process for similar situations should involve a systematic evaluation of the evidence, consideration of ethical obligations to individual patients and the broader population, and engagement with relevant stakeholders within the established governance structures of the Canadian healthcare system. This includes understanding the principles of health policy and how to advocate for evidence-based change effectively and ethically. Question 2. The monitoring system demonstrates a patient presenting with symptoms that could indicate a serious underlying condition, but the immediate clinical presentation is not acutely life-threatening. The physician must decide whether to initiate a high-cost, specialized diagnostic workup immediately or to pursue a more conservative, phased approach involving closer outpatient monitoring and less resource-intensive investigations first. Option A. Immediately proceed with the most advanced and expensive diagnostic tests available, as the potential for a serious condition, however remote, warrants the highest level of immediate investigation. Option B. Defer any further investigation until the patient's symptoms significantly worsen, assuming that if the condition were truly serious, it would manifest more acutely. Option C. Initiate a comprehensive, multidisciplinary risk assessment that considers the patient's overall health status, potential for deterioration, and the availability of alternative diagnostic pathways, consulting with relevant specialists to determine the most appropriate and resource-efficient diagnostic strategy. Option D. Rely on personal experience and intuition to determine the urgency of the diagnostic workup, prioritizing tests that the physician is most familiar with, regardless of cost or evidence of efficacy for this specific presentation. The correct answer is C. Initiate a comprehensive, multidisciplinary risk assessment that considers the patient's overall health status, potential for deterioration, and the availability of alternative diagnostic pathways, consulting with relevant specialists to determine the most appropriate and resource-efficient diagnostic strategy. Explanation. This scenario presents a professional challenge because it requires a physician to balance the immediate needs of a patient with the broader implications of resource allocation and potential future risks within the Canadian healthcare system. The physician must not only assess the individual patient's risk, but also consider the systemic impact of their decision, adhering to the principles of medical ethics and the regulatory framework governing medical practice in Canada, as overseen by provincial/territorial medical regulatory authorities and the Medical Council of Canada, MCC. Careful judgment is required to ensure patient safety while maintaining the integrity and sustainability of healthcare services. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based risk assessment that considers multiple factors beyond immediate clinical presentation. This aligns with the MCC's emphasis on physician competence, professional judgment, and the ethical obligation to provide safe and effective care. By involving a multidisciplinary team and consulting relevant guidelines, the physician demonstrates adherence to best practices in risk management, ensuring that the patient receives appropriate care while also considering the judicious use of healthcare resources. This approach is ethically sound, promoting patient well-being and responsible stewardship of healthcare. An incorrect approach that focuses solely on the immediate clinical need without considering broader risk factors or available resources would be professionally unacceptable. This could lead to inappropriate utilization of specialized services, potentially diverting resources from other patients who may have a higher or more urgent need. Such a decision could be seen as a failure to exercise sound professional judgment and could contravene ethical principles related to fairness and equity in healthcare access. Furthermore, it might not align with the expectations of provincial/territorial medical regulatory authorities regarding responsible resource management. Another incorrect approach that relies on anecdotal evidence or personal bias, rather than objective assessment, would be a significant regulatory and ethical failure. This demonstrates a lack of commitment to evidence-based medicine and professional accountability, which are core tenets of physician practice in Canada. It could also lead to discriminatory practices if the bias is related to patient demographics or socioeconomic status. A third incorrect approach that neglects to document the rationale for the decision or to involve appropriate colleagues would also be professionally unacceptable. Inadequate documentation hinders accountability and can impede future care if the patient's condition changes or if a review of the decision is required. Failure to consult with colleagues when appropriate can lead to suboptimal patient care and represents a missed opportunity for collaborative decision-making, which is often encouraged in complex cases. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive patient information, including clinical history, current status, and relevant social determinants of health. 2. Conduct a thorough risk assessment, considering both immediate and potential future risks, utilizing validated tools and evidence-based guidelines where available. 3. Consult with relevant specialists and a multidisciplinary team to gain diverse perspectives and expertise. 4. Consider the availability of resources and the potential impact of the decision on other patients and the healthcare system. 5. Document the assessment, the rationale for the decision, and the management plan clearly and comprehensively. 6. Communicate the plan effectively to the patient, their family if appropriate, and other members of the healthcare team. 7. Regularly review and reassess the patient's condition and the effectiveness of the management plan. Question 3. Regulatory review indicates that a physician is presented with a patient exhibiting vague abdominal pain, nausea, and a low-grade fever. The physician has conducted an initial history and physical examination. Which of the following approaches to formulating a differential diagnosis best aligns with the Medical Council of Canada's standards for comprehensive patient assessment and diagnostic reasoning? Option A. Focusing exclusively on the most common cause of abdominal pain in the patient's demographic and proceeding with treatment for that condition. Option B. Developing a comprehensive list of potential diagnoses based on the initial assessment, systematically evaluating the likelihood of each, and planning targeted investigations to differentiate them. Option C. Immediately ordering a broad panel of laboratory tests and imaging studies to cover all possible gastrointestinal and systemic causes of the symptoms. Option D. Relying solely on the patient's description of their symptoms to guide the diagnostic process, without further objective investigation. The correct answer is C. Immediately ordering a broad panel of laboratory tests and imaging studies to cover all possible gastrointestinal and systemic causes of the symptoms. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient exhibits symptoms that could be attributed to multiple underlying conditions. The professional challenge lies in the physician's responsibility to systematically consider and differentiate these possibilities to arrive at the most accurate diagnosis, thereby ensuring appropriate and timely patient care. Failure to do so can lead to delayed or incorrect treatment, potentially causing harm. The physician must balance the need for thoroughness with the practicalities of clinical workflow and resource utilization, all while adhering to the standards of practice expected by the Medical Council of Canada. Correct approach analysis. The correct approach involves a structured and comprehensive differential diagnosis formulation process. This begins with a detailed history and physical examination, followed by the generation of a broad list of potential diagnoses. Each potential diagnosis is then systematically evaluated based on the patient's specific signs, symptoms, risk factors, and initial investigations. This iterative process, often involving further targeted investigations, allows the physician to narrow down the possibilities and prioritize the most likely diagnoses. This aligns with the Medical Council of Canada's emphasis on evidence-based practice, patient safety, and the physician's duty of care to conduct a thorough diagnostic workup. It ensures that all reasonable explanations for the patient's presentation are considered, minimizing the risk of overlooking a serious condition. Incorrect approaches analysis. One incorrect approach is to prematurely focus on a single, most obvious diagnosis without adequately exploring other plausible explanations. This can lead to diagnostic bias and the omission of critical differential diagnoses, potentially resulting in a missed or delayed diagnosis. This failure to consider alternatives contravenes the Medical Council of Canada's expectations for comprehensive patient assessment and diagnostic reasoning. Another incorrect approach is to order a wide array of indiscriminate tests without a clear diagnostic rationale linked to the differential diagnoses. Thoroughness is important. An unfocused investigative strategy can lead to unnecessary patient discomfort, increased healthcare costs, and the generation of incidental findings that may not be clinically relevant. This approach lacks the systematic evaluation required by professional standards and can be inefficient. A third incorrect approach is to rely solely on the patient's self-reported symptoms without corroborating them with objective findings from the physical examination or initial investigations. While patient history is crucial, it must be integrated with objective data to form a complete clinical picture. This isolated reliance on subjective information can lead to misinterpretations and an incomplete differential diagnosis, failing to meet the comprehensive assessment standards. Professional reasoning. Professionals should employ a systematic approach to differential diagnosis. This involves 1. Gathering comprehensive patient information, history, physical exam, past medical history, medication, social history. 2. Generating a broad list of potential diagnoses based on the presenting complaint and relevant pathophysiology. 3. Ranking these diagnoses by likelihood, severity, and treatability. 4. Developing a plan for further investigations and management to confirm or refute the most likely diagnoses. And 5. Reassessing the differential diagnosis as new information becomes available. This iterative process ensures that patient care is guided by a well-reasoned and evolving diagnostic understanding, adhering to the ethical and professional obligations mandated by the Medical Council of Canada. Question 4. The evaluation methodology shows that a physician is assessing a patient's understanding of a new diagnosis and treatment plan. Which questioning strategy best facilitates a thorough and accurate assessment of the patient's comprehension, ensuring adherence to professional standards for patient communication and education? Option A. Primarily using open-ended questions to allow the patient to freely express their understanding. Option B. Relying on the patient's verbal confirmation that they understand the information provided. Option C. Employing a mix of open-ended questions to encourage elaboration and closed-ended questions to confirm specific details. Option D. Exclusively utilizing closed-ended questions to ensure all key aspects of the diagnosis and treatment are covered. The correct answer is C. Employing a mix of open-ended questions to encourage elaboration and closed-ended questions to confirm specific details. Explanation. The evaluation methodology shows that a physician is assessing a patient's understanding of a new diagnosis and treatment plan. This scenario is professionally challenging because effective communication is paramount to patient safety and adherence to treatment, directly impacting health outcomes. The physician must gauge the patient's comprehension accurately to ensure informed consent and to identify any potential misunderstandings that could lead to adverse events or noncompliance. The correct approach, utilizing a combination of open-ended and closed-ended questions, represents best professional practice as it allows for a comprehensive assessment of patient understanding. Open-ended questions such as, "Can you tell me in your own words what you understand about your condition and the treatment we discussed?" encourage the patient to articulate their knowledge freely, revealing the depth and accuracy of their comprehension. This aligns with the Medical Council of Canada's (MCC) emphasis on patient-centered care and effective communication, which are fundamental to ethical medical practice and patient safety. Closed-ended questions, like "Are you experiencing any side effects from the medication?" are then used to confirm specific details or address particular concerns, ensuring all critical aspects are covered. This balanced approach respects the patient's autonomy and promotes shared decision-making, as mandated by ethical guidelines and professional standards. An approach relying solely on open-ended questions might be insufficient if the patient is reticent or has limited ability to express their understanding, potentially leaving critical gaps unaddressed. Conversely, an approach exclusively using closed-ended questions risks creating a superficial understanding, where the patient may simply agree with prompts without truly grasping the implications of their diagnosis or treatment. This could lead to a failure to identify misunderstandings, which is a breach of the physician's duty of care, and could contraindicate the principles of informed consent, a cornerstone of medical ethics and regulatory compliance in Canada. Relying solely on the patient's verbal affirmation without probing for deeper understanding also fails to meet the standard of ensuring comprehension, potentially leading to suboptimal patient outcomes and contravening the MCC's expectations for thorough patient assessment. The professional decision-making process in such situations should involve a dynamic interplay between open and closed questioning. The physician should begin with broader, open-ended inquiries to allow the patient to express their understanding. Based on the patient's responses, the physician should then employ targeted closed-ended questions to clarify specific points, confirm understanding of critical information, e.g., medication dosage, appointment schedules, warning signs, and address any emerging concerns. This iterative process ensures that the assessment is both comprehensive and tailored to the individual patient's needs and communication style, thereby upholding the highest standards of patient care and professional responsibility, as outlined by the MCC. Question 5. Stakeholder feedback indicates that some candidates struggle with the systematic application of examination techniques for specific body systems during their assessments. A 65-year-old male presents to your clinic complaining of intermittent chest discomfort, which he describes as a tightness that sometimes radiates to his left arm. He denies any shortness of breath or palpitations. Based on this presentation, which of the following approaches to the physical examination would be most appropriate to begin with to investigate his symptoms? Option A. Focus solely on asking further subjective questions about the nature and duration of the chest discomfort. Option B. Perform a rapid, generalized palpation of the patient's abdomen. Option C. Begin with a thorough palpation of peripheral pulses and auscultation of heart sounds. Option D. Immediately proceed to a detailed neurological examination of the upper extremities. Correct answer is C. Begin with a thorough palpation of peripheral pulses and auscultation of heart sounds. Explanation. Scenario analysis. This scenario presents a common challenge in medical practice where a patient's subjective report of symptoms requires objective corroboration through physical examination. The challenge lies in selecting the most appropriate examination technique to accurately assess the patient's complaint while ensuring patient comfort and safety. Adhering to professional standards of care as outlined by the Medical Council of Canada, MCC, the physician must balance the need for thoroughness with efficiency and patient-centeredness. Correct approach analysis. The correct approach involves a systematic and targeted examination of the cardiovascular system, beginning with inspection and palpation of peripheral pulses, followed by auscultation of heart sounds. This sequence is crucial because peripheral pulses provide an initial assessment of peripheral circulation and rhythm, which can inform the subsequent cardiac auscultation. Auscultation allows for the detection of murmurs, gallops, or other abnormal heart sounds that might explain the patient's reported symptoms. This methodical approach aligns with the MCC's emphasis on evidence-based practice and the requirement for physicians to conduct comprehensive and appropriate examination to arrive at an accurate diagnosis. It respects the patient's dignity and minimizes unnecessary discomfort. Incorrect approach is analysis. Performing a rapid, generalized palpation of the abdomen without specific attention to the cardiovascular system is professionally unacceptable. This fails to directly address the patient's stated concern and deviates from the expected standard of care for investigating cardiac symptoms. It represents a failure to apply appropriate examination techniques for the body system in question, potentially leading to a misdiagnosis and a breach of the duty of care. Immediately proceeding to a detailed neurological examination without first thoroughly assessing the cardiovascular system is also professionally unacceptable. While neurological symptoms can sometimes be related to cardiac issues, e.g., stroke, a direct cardiac assessment is the primary and most logical step when chest discomfort is reported. This approach demonstrates a lack of clinical reasoning and prioritization, potentially delaying the diagnosis of a critical cardiac condition. Focusing solely on asking further subjective questions about the chest discomfort without any physical examination is a significant regulatory and ethical failure. The MCC mandates that physicians utilize physical examination as a cornerstone of diagnosis. Relying only on subjective reporting, especially when objective findings are readily obtainable and crucial for diagnosis, falls below the expected standard of practice and could be considered negligent. Professional reasoning. Physicians should employ a structured approach to physical examination, starting with general observations and then proceeding to system-specific assessments based on the patient's chief complaint. This involves a process of differential diagnosis, where potential causes are considered and then systematically investigated through history and physical examination. When a patient presents with symptoms suggestive of a specific body system, the physician's initial focus should be on the most relevant examination techniques for that system. This systematic approach ensures that all pertinent information is gathered, leading to a more accurate diagnosis and appropriate management plan, in accordance with the standards set by the Medical Council of Canada. Question 6. Implementation of a new medication regimen for a patient with chronic heart failure has led to a subtle but persistent increase in their respiratory rate and a slight decrease in their peripheral oxygen saturation, despite no reported increase in dyspnea. The patient has a history of mild renal insufficiency. What is the most appropriate initial step for the physician to take? Option A. Immediately increase the dose of their diuretic to address potential fluid overload contributing to the respiratory changes. Option B. Reassure the patient that these changes are likely minor and will resolve with time, advising them to monitor for worsening symptoms. Option C. Assess the patient's current fluid balance and renal function and consider a review of the medication regimen for potential adverse effects on respiratory or renal physiology. Option D. Order a chest X-ray to rule out pneumonia as the cause of the increased respiratory rate. The correct answer is C. Assess the patient's current fluid balance and renal function, and consider a review of the medication regimen for potential adverse effects on respiratory or renal physiology. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the potential for rapid physiological decompensation in a patient with a known underlying condition. The challenge lies in recognizing subtle signs of homeostatic imbalance and responding promptly and appropriately, balancing the need for intervention with the risk of iatrogenic harm. The physician must integrate knowledge of normal physiological processes with the patient's specific pathology and current clinical presentation. Correct approach analysis. The correct approach involves a systematic assessment of the patient's vital signs and relevant physiological parameters, coupled with a targeted investigation to identify the underlying cause of the observed changes. This aligns with the Medical Council of Canada's emphasis on evidence-based practice and patient safety. Promptly initiating appropriate management based on the identified physiological derangement, while continuously monitoring the patient's response, represents best professional practice. This demonstrates adherence to the principles of good medical practice, which mandate thorough assessment, accurate diagnosis, and effective treatment. Incorrect approach is analysis. One incorrect approach would be to dismiss the observed changes as insignificant or unrelated to the patient's underlying condition without further investigation. This failure to recognize potential signs of homeostatic disruption could lead to delayed diagnosis and treatment, potentially resulting in severe morbidity or mortality. Ethically, this represents a breach of the duty of care and professional responsibility to act in the patient's best interest. Another incorrect approach would be to initiate aggressive, broad-spectrum interventions without a clear diagnostic hypothesis or understanding of the specific physiological imbalance. This could lead to unnecessary side effects, masking of the true pathology, and potential harm to the patient. This approach deviates from the principle of judicious use of medical resources and could be considered negligent. A third incorrect approach might involve relying solely on past experience or intuition without a systematic, evidence-based assessment of the current situation. While experience is valuable, it must be grounded in current clinical knowledge and applied to the specific patient presentation. Failure to do so risks misdiagnosis and inappropriate management, which is contrary to the standards of practice expected by the Medical Council of Canada. Professional reasoning. Professionals should employ a structured approach to patient assessment, starting with a comprehensive history and physical examination, followed by the judicious use of diagnostic investigations. This should be guided by a differential diagnosis based on the patient's presentation and underlying conditions. Treatment decisions should be evidence-based, tailored to the individual patient, and continuously re-evaluated based on the patient's response. This systematic process ensures that patient care is safe, effective, and aligned with professional standards and ethical obligations. Question 7. The assessment process reveals that a physician is considering a novel therapeutic agent for a chronic condition. The agent has shown promising results in a small, early-phase clinical trial published in a peer-reviewed journal, and several colleagues have mentioned positive anecdotal experiences. However, a large, multi-center randomized controlled trial is still underway and has not yet published its findings. The physician is weighing whether to incorporate this agent into their practice for eligible patients. Which of the following approaches best reflects the principles of evidence-based medicine as expected by the Medical Council of Canada? Option A. Rely primarily on personal clinical experience and the anecdotal reports from colleagues to guide the decision on whether to use the new agent. Option B. Defer any consideration of the new agent until the results of the large, multi-center randomized controlled trial are published and widely accepted. Option C. Immediately adopt the new agent for all eligible patients, given the promising early results and positive anecdotal reports from colleagues. Option D. Systematically appraise the quality and applicability of the early-phase trial, considering its limitations, and integrate this with clinical expertise and patient values, while acknowledging the need for further evidence from ongoing trials. Correct answer is D. Systematically appraise the quality and applicability of the early-phase trial, considering its limitations, and integrate this with clinical expertise and patient values, while acknowledging the need for further evidence from ongoing trials. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a physician to critically evaluate the quality and applicability of medical evidence when making clinical decisions. The physician must balance the desire to adopt new, potentially beneficial treatments with the responsibility to ensure that these treatments are supported by robust, relevant evidence and are appropriate for their specific patient population. This involves navigating the inherent uncertainties in medical research and the potential for bias in study design and reporting. Correct approach analysis. The correct approach involves a systematic appraisal of the evidence, prioritizing high-quality research that directly addresses the clinical question and patient population. This aligns with the core principles of evidence-based medicine (EBM), as promoted by the Medical Council of Canada (MCC). EBM emphasizes the integration of the best available research evidence with clinical expertise and patient values. Specifically, the MCC expects physicians to be proficient in critically appraising research, understanding study designs, assessing the risk of bias, and evaluating the generalizability of findings. Adhering to this approach ensures that treatment decisions are informed by reliable data, maximizing patient benefit and minimizing harm, thereby upholding the physician's ethical and professional obligations. Incorrect approaches analysis. One incorrect approach involves readily adopting a new treatment based solely on anecdotal reports or preliminary findings without rigorous scrutiny. This fails to meet the MCC's expectations for evidence-based practice. Anecdotal evidence lacks the scientific rigor required for clinical decision-making and can be subject to significant bias. Relying on such information can lead to the adoption of ineffective or even harmful treatments, violating the principle of do no harm and failing to uphold professional standards of care. Another incorrect approach is to dismiss a new treatment simply because it is not yet widely adopted or has not been extensively studied in the physician's specific subspecialty. A caution is warranted. A complete dismissal without critical appraisal of existing high-quality evidence, even if from related populations or study designs, may mean withholding potentially beneficial interventions from patients. This can be seen as a failure to stay abreast of medical advancements and to provide optimal care, potentially contravening the physician's duty to their patients. A third incorrect approach is to prioritize the physician's personal experience or preference over the available scientific evidence. While clinical expertise is a crucial component of EBM, it should complement, not supersede, the best available research. Making decisions based solely on personal bias or past experience, without considering current, high-quality evidence, can lead to suboptimal patient outcomes and represents a departure from the principles of objective, evidence-informed practice expected by the MCC. Professional reasoning. Physicians should employ a structured decision-making process when evaluating new evidence. This involves 1. Formulating a clear clinical question, 2. Conducting a comprehensive search for relevant literature, prioritizing systematic reviews and randomized controlled trials, 3. Critically appraising the identified evidence for validity, impact, and applicability. 4. Integrating the appraised evidence with clinical expertise and the patient's unique circumstances, values, and preferences. 5. Evaluating the outcomes of the decision and adjusting the approach as necessary. This iterative process ensures that clinical decisions are grounded in the best available science while remaining patient-centered and ethically sound, in accordance with the standards set by the Medical Council of Canada. Question 8. Operational review demonstrates that a physician has been treating a patient with a serious, life-limiting illness. The patient has been hesitant to discuss their prognosis or treatment options with their family, citing a desire to protect them from distress. However, the patient's adult children have expressed significant concern to the physician about their parents' health and have requested information regarding the patient's condition and care plan. The physician is aware that the patient's family plays a crucial role in their support system. What is the most ethically and professionally appropriate course of action for the physician in this situation, adhering strictly to the Medical Council of Canada's regulatory framework and ethical guidelines? Option A. Inform the patient that their family's concerns are significant and that the physician will be scheduling a meeting with the family to discuss the patient's condition. Regardless of the patient's wishes, Option B. Arrange for a hospital social worker to meet with the family to convey the patient's medical information and to mediate a discussion about the patient's care, without first speaking directly with the patient about their consent. Option C. Immediately provide the patient's adult children with a detailed update on the patient's diagnosis, prognosis, and treatment plan, explaining that their concern warrants disclosure. Option D. Initiate a direct conversation with the patient to explore their feelings about sharing information with their family, offering support and guidance on how they might approach this discussion, and respecting their decision on what and when to disclose. Correct answer is D. Initiate a direct conversation with the patient to explore their feelings about sharing information with their family, offering support and guidance on how they might approach this discussion, and respecting their decision on what and when to disclose. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a physician's duty to provide comprehensive care and the patient's right to autonomy and privacy. The physician must navigate the sensitive nature of the information, the potential impact on the patient's relationships, and the legal and ethical obligations to both the patient and their family, all while maintaining trust and therapeutic alliance. The requirement to communicate effectively under these circumstances is paramount to ensuring patient well-being and upholding professional standards. Correct approach analysis. The most effective approach involves direct, empathetic, and clear communication with the patient, respecting their privacy and autonomy. This aligns with the principles of informed consent and patient-centered care, fundamental to the Medical Council of Canada's ethical guidelines. By first speaking with the patient, the physician respects their right to control their own health information and to decide how and when it is shared. This approach fosters trust and allows the physician to understand the patient's perspective, fears, and wishes regarding disclosure. It also provides an opportunity to explore potential support systems with the patient, empowering them to make informed decisions about involving their family. This respects the physician's duty of confidentiality, while also addressing the family's concerns in a manner that prioritizes the patient agency. Incorrect approaches analysis. Disclosing the patient's diagnosis and prognosis directly to the family without the patient's explicit consent violates the physician's duty of confidentiality, a cornerstone of medical ethics and regulated by the Medical Council of Canada. This action undermines patient trust and can have severe legal and professional repercussions. It disregards the patient's autonomy and right to privacy, potentially causing significant distress and damage to the patient-physician relationship. Delaying communication with the family indefinitely, while seemingly respecting patient privacy, can be professionally problematic if it leads to a breakdown in family support that is crucial for the patient's care and well-being, especially if the patient has implicitly or explicitly indicated a desire for family involvement in their care. While patient autonomy is key, a complete lack of engagement with concerned family members, when appropriate and with patient consent, can hinder holistic care. However, this is less of a direct ethical violation than unauthorized disclosure, involving a hospital social worker to mediate a discussion with the family before speaking with the patient, while a potentially helpful step in some complex situations, bypasses the primary ethical obligation to communicate directly with the patient first about their own health information. This approach risks undermining the patient's sense of control and can be perceived as a lack of direct engagement from the physician, potentially creating a barrier to open communication with the patient themselves. Professional reasoning. Professionals should employ a patient-centered communication framework. This involves prioritizing direct communication with the patient, actively listening to their concerns, and respecting their autonomy and confidentiality. When sensitive information is involved, the physician should assess the patient's capacity to make decisions and their wishes regarding disclosure. If the patient consents to sharing information with family, the physician should facilitate this process, ensuring the patient is comfortable with the extent and manner of disclosure. If the patient is unable to consent or express their wishes, the physician must act in the patient's best interest, considering established ethical guidelines and potentially seeking guidance from ethics committees or legal counsel, always with the goal of preserving the patient's dignity and well-being. Question 9. Governance review demonstrates a physician is consistently obtaining incomplete medical histories from patients who identify with specific cultural backgrounds, often due to perceived reluctance to disclose sensitive personal information. The physician's standard approach involves direct, detailed questioning within a fixed time frame. Which of the following strategies best addresses this challenge, while adhering to the Medical Council of Canada's expectations for culturally competent practice? Option A. Proactively inquire about the patient's cultural background and communication preferences at the outset of the interview, and adapt the pace and style of questioning to foster trust and encourage open disclosure. Option B. Focus on efficiently gathering essential medical facts, acknowledging that some personal details may be difficult for certain patients to share and may need to be omitted for the sake of time. Option C. Assume that patients from similar cultural backgrounds will have similar communication barriers and apply a standardized set of alternative questions to all such patients. Option D. Reiterate the importance of providing a complete history for accurate diagnosis and insist on direct answers to all questions, regardless of the patient's apparent discomfort. The correct answer is A. Proactively inquire about the patient's cultural background and communication preferences at the outset of the interview, and adapt the pace and style of questioning to foster trust and encourage open disclosure. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the physician to navigate potential cultural misunderstandings that could impede accurate history-taking. The patient's reluctance to disclose sensitive information due to cultural norms or past negative experiences with healthcare providers necessitates a sensitive and adaptable approach. Failure to address these underlying factors can lead to incomplete or inaccurate medical histories, impacting diagnosis and treatment. Correct approach analysis. The correct approach prioritizes building trust and rapport by acknowledging and respecting the patient's cultural background and communication preferences. This aligns with the Medical Council of Canada's (MCC) emphasis on patient-centered care and the ethical obligation to provide culturally safe and competent medical services. By actively seeking to understand the patient's perspective and adapting communication strategies accordingly, the physician demonstrates respect for the patient's autonomy and dignity, fostering an environment where open communication is more likely. This approach is directly supported by the MCC's CertMedbry framework, which highlights the importance of the communicator role, emphasizing effective communication with patients and colleagues, and the need to understand the social and cultural determinants of health. Incorrect approaches analysis. An approach that dismisses the patient's concerns or insists on a standard, rigid questioning style fails to acknowledge the impact of culture on health beliefs and practices. This can be perceived as disrespectful and may alienate the patient, leading to further withholding of information. Ethically, this violates the principle of respect for persons and can be seen as a failure to provide culturally competent care, which is a professional expectation outlined by the MCC. An approach that assumes all patients from a particular cultural group will behave identically is a form of stereotyping. This is professionally unacceptable as it ignores individual differences and can lead to misinterpretations and inappropriate care. The MCC expects physicians to treat each patient as an individual, recognizing the diversity within cultural groups. An approach that focuses solely on eliciting information without regard for the patient's comfort or cultural context risks creating a transactional rather than a therapeutic relationship. This can lead to patient dissatisfaction and a reluctance to engage in future healthcare interactions, undermining the long-term health outcomes. It also fails to meet the MCC's standards for compassionate and ethical patient care. Professional reasoning. When faced with a patient whose communication style or disclosure patterns may be influenced by cultural factors, the professional decision-making process should involve 1. Self-reflection, recognizing one's own potential biases and assumptions about different cultures. 2. Active listening and observation, paying close attention to the patient's verbal and nonverbal cues. 3. Open-ended inquiry, using questions that encourage the patient to share their perspective and concerns. 4. Cultural humility, approaching the interaction with a willingness to learn from the patient about their cultural background and how it influences their health. 5. Adaptability, being prepared to modify communication strategies to accommodate the patient's preferences and comfort level. 6. Seeking clarification, if unsure about a cultural nuance, respectfully asking the patient for clarification. Question 10. Investigation of a patient presenting with symptoms highly suggestive of a novel, highly contagious respiratory illness reveals they are hesitant to adhere to public health recommendations for isolation and testing due to concerns about job security and fear of stigma. The physician must decide on the most appropriate course of action to protect the public while respecting the patient's rights and addressing their concerns. Which of the following approaches best aligns with the ethical and regulatory framework for physicians in Canada? Option A. Breach patient confidentiality by contacting the patient's employer to explain the situation and urge them to provide paid leave, hoping this will encourage compliance. Option B. Advise the patient to self-isolate but take no further action, assuming they will eventually comply once they understand the risks. Option C. Provide the patient with comprehensive information about the illness, its transmission, and the importance of isolation and testing, while actively exploring their concerns about job security and stigma, and collaboratively developing a plan to mitigate these barriers to adherence. Option D. Immediately report the patient to public health authorities for mandatory isolation, citing the potential risk to the community, without further discussion with the patient. Correct answer is D. Immediately report the patient to public health authorities for mandatory isolation, citing the potential risk to the community, without further discussion with the patient. Explanation. This scenario presents a common challenge in public health, balancing individual autonomy with the collective good when addressing a preventable disease outbreak. The physician must navigate the ethical principles of beneficence, acting in the patient's best interest, non-maleficence, avoiding harm, autonomy, respecting the patient's right to make decisions, and justice, fair distribution of resources and equitable treatment. The Medical Council of Canada's MCC guidelines emphasize the physician's role in promoting public health and disease prevention, while also upholding patient confidentiality and informed consent. Challenge lies in determining the appropriate level of intervention when a patient's choices pose a risk to others, particularly in the context of communicable disease. The correct approach prioritizes a comprehensive, patient-centered strategy that respects autonomy while effectively mitigating public health risks. This involves thorough education, addressing barriers to adherence, and exploring all avenues for voluntary compliance before considering any mandatory measures. This aligns with the MCC's emphasis on patient-physician relationships built on trust and shared decision-making. It also reflects the ethical imperative to exhaust less restrictive means when intervening in a patient's life, thereby upholding the principle of proportionality. An incorrect approach that focuses solely on immediate isolation, without attempting to understand or address the patient's concerns or barriers, fails to uphold the principle of autonomy. It bypasses the crucial step of informed consent and shared decision-making, potentially leading to patient distrust and noncompliance in the future. Furthermore, a purely punitive or coercive approach can be seen as a violation of the physician's duty of care and may not be supported by public health legislation, which typically requires a clear demonstration of imminent risk and failure of less restrictive measures. Another incorrect approach that involves breaching confidentiality without a clear legal or ethical justification, e.g., imminent danger to a specific identifiable individual that cannot be otherwise prevented, would be a direct contravention of privacy regulations and ethical standards. Professionals should employ a decision-making framework that begins with a thorough assessment of the situation, including the specific disease, its transmission, and the patient's individual circumstances. This should be followed by open communication with the patient, providing clear and understandable information about the risks and benefits of different actions. The physician should then collaboratively develop a plan that addresses the patient's concerns and barriers to adherence. If voluntary measures are insufficient, the physician must consider the legal and ethical frameworks for escalating interventions, always prioritizing the least restrictive means necessary to protect public health. This process emphasizes shared responsibility and empowers the patient to participate in their health management and the protection of the community. Question 11. What factors determine the most appropriate initial diagnostic approach for a patient presenting with new-onset shortness of breath and chest discomfort? Option A. The patient's preference for a specific diagnostic test, regardless of clinical indication. Option B. The availability of the most advanced diagnostic technology in the local hospital. Option C. The patient's age, presence of risk factors for cardiovascular disease, and the character of the chest discomfort. Option D. The physician's personal experience with similar-looking cases in the past, without further objective assessment. The correct answer is C. The patient's age, presence of risk factors for cardiovascular disease, and the character of the chest discomfort. Explanation. Scenario analysis. This scenario presents a common challenge in primary care: a patient with a constellation of symptoms that could indicate several different conditions, some of which are serious and require prompt intervention. The challenge lies in differentiating between these possibilities efficiently and accurately, ensuring patient safety while avoiding unnecessary investigations. The physician must synthesize information from the patient's history, physical examination, and potentially initial diagnostic tests to arrive at the most likely diagnosis and appropriate management plan. This requires a strong understanding of common disease presentations and their differential diagnoses, as well as the ability to prioritize investigations based on clinical suspicion and potential severity. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's symptoms, considering the most likely diagnoses that fit the clinical picture. This includes a thorough history to elicit details about symptom onset, duration, character, aggravating and relieving factors, and associated symptoms. A comprehensive physical examination is crucial to identify objective signs. Based on this initial assessment, the physician then formulates a differential diagnosis and prioritizes investigations that will most effectively confirm or refute the leading diagnoses, with a focus on ruling out life-threatening conditions first. This aligns with the Medical Council of Canada's emphasis on evidence-based practice, patient safety, and the responsible use of healthcare resources. The physician's duty of care, as outlined by the College of Physicians and Surgeons of Ontario, or relevant provincial college, mandates a thorough and competent assessment. Incorrect approaches analysis. An approach that immediately jumps to a single, less common diagnosis without adequately considering more prevalent or serious alternatives demonstrates a failure in systematic clinical reasoning. This could lead to delayed diagnosis and treatment of the actual condition, potentially causing harm to the patient. It also represents a deviation from the expected standard of care, which requires a comprehensive differential diagnosis. Another incorrect approach would be to order a broad range of investigations without a clear diagnostic hypothesis. This is inefficient, costly, and can lead to incidental findings that cause patient anxiety and further unnecessary investigations. It fails to demonstrate judicious use of diagnostic resources, a principle implicitly supported by the Canadian healthcare system's emphasis on sustainability and value. Finally, dismissing the patient's symptoms without a thorough assessment, perhaps due to perceived chronicity or nonspecific nature, is a significant ethical and professional failure. It violates the physician's duty to investigate and manage patient complaints competently and compassionately, as expected by the Medical Council of Canada's ethical guidelines and the provincial regulatory colleges. Professional reasoning. Professionals should employ a structured approach to clinical problem solving. This begins with active listening and gathering a detailed history, followed by a targeted physical examination. The next step is to generate a differential diagnosis, listing all plausible conditions that could explain the patient's presentation, ordered by likelihood and severity. Investigations should then be selected to efficiently narrow down this differential, prioritizing those that can rule out serious or life-threatening conditions. This iterative process of assessment, hypothesis generation, and investigation allows for accurate diagnosis and appropriate management, upholding the highest standards of patient care as mandated by the Medical Council of Canada and provincial regulatory bodies. Question 12. When evaluating a patient presenting with acute abdominal pain, a physician needs to precisely describe the location of tenderness to a surgical colleague. The patient reports pain primarily in the right lower quadrant. Which of the following descriptions best utilizes accurate anatomical terminology for this region? Option A. The tenderness is located in the right iliac fossa. Option B. The tenderness is near the hip bone on the right. Option C. The tenderness is on the right side below the belly button. Option D. The tenderness is in the area of the appendix. The correct answer is A. The tenderness is located in the right iliac fossa. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the physician to accurately identify and communicate anatomical structures in a critical situation where miscommunication could lead to significant patient harm. The pressure of an emergency setting can exacerbate the risk of error. Precise anatomical knowledge is paramount for effective diagnosis and treatment planning, especially when communicating with other healthcare professionals. Correct approach analysis. The correct approach demonstrates best professional practice by utilizing precise and universally understood anatomical terminology. This aligns with the Medical Council of Canada's emphasis on clear and accurate communication in patient care, as outlined in their CertMedbry framework, which stresses the importance of medical expert roles, including the ability to accurately describe and locate anatomical structures. Using established anatomical landmarks ensures that all members of the healthcare team have a shared understanding, minimizing the potential for errors in diagnosis or intervention. Incorrect approach is analysis. An approach that relies on vague or colloquial descriptions fails to meet the standard of professional communication expected by the Medical Council of Canada. Such descriptions are subjective and open to misinterpretation, potentially leading to incorrect assessments or treatments. This represents a failure in the physician's duty of care and professional responsibility to communicate effectively. An approach that uses outdated or regionally specific anatomical terms, while perhaps understood by some, is not universally recognized and can lead to confusion, especially in a diverse healthcare environment. The Medical Council of Canada promotes standardized practices, and this includes the use of current, widely accepted anatomical nomenclature. An approach that prioritizes speed over accuracy by guessing or approximating anatomical locations is a direct contravention of the ethical and professional obligation to provide competent care. This demonstrates a lack of diligence and a disregard for the potential consequences of inaccurate information, which could result in patient harm and professional misconduct. Professional reasoning. Professionals should approach such situations by first ensuring a thorough understanding of the patient's presentation. This involves recalling and applying precise anatomical knowledge. When communicating, they should default to standardized, universally accepted anatomical terminology. If there is any uncertainty, it is professional practice to clarify or seek confirmation rather than proceeding with potentially inaccurate information. This systematic approach, grounded in knowledge and clear communication, is essential for patient safety and upholding professional standards. Question 13. Market research demonstrates that many medical students struggle to apply generalized anatomical and physiological principles to individual patient presentations. A physician is evaluating a patient presenting with symptoms that are not perfectly aligned with the textbook description of a common condition. Which of the following approaches best reflects the expected standard of practice as outlined by the Medical Council of Canada? Option A. Conduct a thorough physical examination and take a detailed patient history, considering potential anatomical and physiological variations, to interpret the patient's unique presentation. Option B. Dismiss the patient's symptoms as atypical and rely solely on the most common textbook presentation of the suspected condition. Option C. Prioritize statistical averages of anatomical measurements over the individual patient's clinical findings when making a diagnosis. Option D. Assume the patient's presentation is a rare anomaly and immediately order extensive, non-specific investigations without further clinical correlation. The correct answer is A. Conduct a thorough physical examination and take a detailed patient history, considering potential anatomical and physiological variations, to interpret the patient's unique presentation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in human anatomy and physiology, even within a defined population. A physician must balance the need for evidence-based practice with the reality of individual patient differences. Over-reliance on generalized anatomical descriptions without considering potential variations can lead to diagnostic errors or inappropriate treatment. The challenge lies in applying broad physiological principles to a specific, unique patient presentation. Correct approach analysis. The correct approach emphasizes the importance of a thorough patient history and physical examination, coupled with an understanding of normal anatomical and physiological variations. This aligns with the Medical Council of Canada's (MCC) emphasis on comprehensive patient assessment as a cornerstone of safe and effective medical practice. The MCC expects physicians to utilize their knowledge of anatomy and physiology to interpret individual patient findings, rather than applying rigid, generalized models. This approach ensures that diagnostic and therapeutic decisions are tailored to the individual, minimizing the risk of harm and maximizing the potential for positive outcomes. It reflects the ethical obligation to provide patient-centered care. Incorrect approach is analysis. An approach that solely relies on textbook anatomical descriptions without considering individual variation is professionally unacceptable. This fails to acknowledge the biological reality of patient diversity and can lead to misinterpretation of findings. Ethically, it breaches the duty of care by not adequately assessing the individual patient. Regulatory failure occurs because it deviates from the MCC's expectation of a thorough and individualized assessment. An approach that dismisses patient-reported symptoms because they deviate from typical physiological responses is also professionally unacceptable. The MCC expects physicians to listen to and investigate patient concerns. Dismissing symptoms based on a rigid adherence to expected physiological pathways without further investigation can lead to misdiagnoses and patient harm. This represents a failure in clinical judgment and a disregard for the patient's experience, which is a fundamental ethical and regulatory requirement. An approach that prioritizes statistical averages over individual clinical presentation, without a clear rationale for doing so in a specific context, is problematic. While statistical data informs medical knowledge, clinical decision-making must be grounded in the individual patient's presentation. Over-reliance on averages can lead to overlooking significant individual deviations that may indicate pathology. This approach fails to meet the MCC's standard for individualized patient care and can be seen as a regulatory and ethical lapse. Professional reasoning. Professionals should approach patient care by first establishing a baseline understanding of normal anatomy and physiology. This knowledge then serves as a framework for interpreting individual patient data. The process involves 1. Gathering comprehensive patient information, history, symptoms, signs. 2. Applying knowledge of anatomy and physiology to understand the potential underlying mechanisms. 3. Critically evaluating how the individual patient's presentation aligns with or deviates from expected norms. 4. Investigating any significant deviations through further examination, investigations, or consultation. 5. Formulating a diagnosis and treatment plan that is individualized and evidence-based, always prioritizing patient safety and well-being. This iterative process ensures that generalized knowledge is applied judiciously to unique individuals. Question 14. Market research demonstrates that patients often present with vague gastrointestinal complaints. A 55-year-old patient reports intermittent abdominal discomfort and changes in bowel habits over the past 3 months. They mention occasional bloating and a feeling of incomplete evacuation. They deny any significant weight loss, rectal bleeding, or a family history of gastrointestinal cancers. However, they do recall a period of increased stress and dietary changes during this time. What is the most appropriate next step in evaluating this patient's history to identify potential red flags? Option A. Immediately schedule the patient for a colonoscopy to rule out any serious pathology, given their age and reported symptoms. Option B. Reassure the patient that stress and dietary changes are common causes of such symptoms and advise them to monitor their condition. Option C. Focus on the patient's denial of weight loss and rectal bleeding, concluding that their symptoms are likely benign and require no further investigation. Option D. Inquire further about the character and timing of the abdominal discomfort, any associated nausea or vomiting, and explore any recent travel or exposure to new foods or environments. The correct answer is D. Inquire further about the character and timing of the abdominal discomfort, any associated nausea or vomiting, and explore any recent travel or exposure to new foods or environments. Explanation. Scenario analysis. This scenario presents a common but challenging implementation challenge in primary care. A physician is faced with a patient exhibiting symptoms that could be indicative of a serious underlying condition. But the patient's history, while containing some concerning elements, also has plausible benign explanations. The challenge lies in differentiating between a genuine red flag requiring urgent investigation and a benign symptom cluster that might lead to unnecessary anxiety and resource utilization. The physician must balance the imperative to rule out serious pathology with the need for efficient and patient-centered care, adhering to the principles of evidence-based medicine and professional responsibility as outlined by the Medical Council of Canada, MCC. Correct approach analysis. The correct approach involves a systematic and thorough evaluation of the patient's history, focusing on the constellation of symptoms and their temporal relationship. It requires the physician to actively probe for specific details that would elevate the suspicion of a serious condition, such as a malignancy or a systemic inflammatory process. This includes inquiring about constitutional symptoms, unexplained weight loss, fever, night sweats, changes in bowel habits, presence of blood in stool, family history of relevant cancers, and any recent travel or exposure history that might suggest an infectious etiology. The MCC's emphasis on comprehensive patient assessment and the application of clinical judgment to identify potential serious conditions is paramount here. This approach prioritizes patient safety by ensuring that potentially life-threatening conditions are not overlooked, aligning with the ethical obligation to provide competent and diligent care. Incorrect approaches analysis. One incorrect approach would be to dismiss the patient's symptoms as likely benign due to the absence of a single, definitive smoking gun in the history. This fails to acknowledge that serious conditions can present with subtle or overlapping symptoms. Ethically, this could constitute a failure to meet the standard of care expected by the MCC, potentially leading to delayed diagnosis and adverse patient outcomes. It neglects the principle of primum non nocere, first, do no harm, by not adequately investigating potential harms. Another incorrect approach would be to immediately order a battery of expensive and invasive investigations without a clear clinical rationale derived from the patient's history. While appearing thorough, this approach can lead to patient anxiety, unnecessary financial burden, and potential iatrogenic complications. It deviates from the principle of judicious resource utilization and may not be supported by evidence-based guidelines for initial assessment, which the MCC expects practitioners to follow. A third incorrect approach would be to rely solely on the patient's self-reported interpretation of their symptoms, without further detailed questioning. Patients may misinterpret symptoms or focus on less significant aspects of their condition. This approach bypasses the physician's critical role in eliciting a detailed and objective history, which is a cornerstone of medical diagnosis and a requirement for competent practice as defined by the MCC. Professional reasoning. Professionals should employ a structured approach to history-taking, starting with open-ended questions, and then progressively narrowing down to specific details based on the patient's initial responses. This involves active listening, critical appraisal of the information provided, and a systematic exploration of differential diagnoses. When red flags are identified, the next step should be to gather more specific information to confirm or refute the suspicion, guiding the subsequent diagnostic and management plan. This iterative process ensures that investigations are targeted and appropriate, aligning with the MCC's standards for professional conduct and patient care. Question 15. The performance metrics show an increase in medication-related errors within the practice. A 78-year-old patient with a history of hypertension, type 2 diabetes, osteoarthritis, and mild renal impairment is presenting for their routine follow-up. They are currently prescribed 5 medications for these conditions. What is the most appropriate initial step to address the potential risks associated with this patient's medication regimen? Option A. Conduct a comprehensive medication review, including assessment for drug-drug interactions, drug-disease interactions, and prescribing opportunities, considering the patient's age and renal function. Option B. Rely on the patient's self-reported adherence and symptom management to guide any necessary adjustments to their current medications. Option C. Prescribe a new medication to manage potential side effects of the existing regimen. Without a full review of the current prescriptions, Option D. Increase the dosage of the patient's antihypertensive medication, as blood pressure readings have been borderline elevated at recent visits. The correct answer is A. Conduct a comprehensive medication review, including assessment for drug-drug interactions, drug-disease interactions, and prescribing opportunities, considering the patient's age and renal function. Explanation. Scenario analysis. This scenario presents a common challenge in medical practice, managing a patient with multiple comorbidities and polypharmacy, where the risk of adverse drug events is elevated. The performance metrics indicating a rise in medication-related errors necessitates a proactive and systematic approach to risk assessment and mitigation. The physician must balance the therapeutic needs of the patient with the potential harms associated with their complex medication regimen, adhering to the standards set by the Medical Council of Canada, MCC, regarding patient safety and professional conduct. Correct approach analysis. The correct approach involves a comprehensive medication review, focusing on identifying potential drug-drug interactions, drug-disease interactions, and inappropriate prescribing based on the patient's age, renal function, and hepatic function. This aligns with MCC guidelines emphasizing evidence-based practice and patient safety. A thorough risk assessment would involve evaluating each medication for its indication, efficacy, dosage, potential side effects, and the patient's adherence. Furthermore, it requires considering deprescribing opportunities, safely discontinuing medications that are no longer indicated or are causing harm. This systematic process minimizes the likelihood of adverse events and optimizes therapeutic outcomes, fulfilling the physician's ethical and professional obligations. Incorrect approaches analysis. Continuing the current prescribing pattern without a targeted review fails to address the identified performance metrics and the inherent risks of polypharmacy, violating the MCC's expectation of continuous quality improvement and patient safety. Increasing the dosage of a medication without a clear indication or further investigation risks exacerbating side effects or masking an underlying issue, which is contrary to responsible prescribing practices. Relying solely on patient self-report without objective assessment or objective data, like lab results, can lead to misjudgments about medication effectiveness or safety, potentially compromising patient care and contravening the MCC's emphasis on thorough patient assessment. Professional reasoning. Professionals facing such a situation should employ a structured approach to medication management. This begins with acknowledging the performance data as a signal for potential issues. The next step is to conduct a comprehensive medication reconciliation, followed by a detailed risk assessment for each medication in the context of the patient's overall health status and other prescribed drugs. This assessment should inform decisions about continuing, adjusting, or discontinuing medications, always prioritizing patient safety and evidence-based practice. Regular follow-up and monitoring are crucial to evaluate the effectiveness and safety of the adjusted regimen. Question 16. The risk matrix shows a patient presenting with acute shortness of breath, hypotension, and altered mental status. Initial investigations reveal elevated cardiac enzymes, acute kidney injury, and evidence of pulmonary edema. Considering the pathophysiology of major organ systems and their interdependencies, which of the following diagnostic and management strategies best reflects a comprehensive approach aligned with Medical Council of Canada standards? Option A. Initiate broad-spectrum antibiotics and fluid resuscitation to address potential sepsis, while closely monitoring vital signs and urine output, and ordering an echocardiogram to assess cardiac function. Option B. Administer high-dose corticosteroids to suppress inflammation, believing this will broadly improve organ function, and await further specialist consultation before initiating specific organ system investigations. Option C. Prioritize immediate intubation and mechanical ventilation to address the pulmonary edema, while deferring further cardiac and renal investigations until respiratory stability is achieved. Option D. Focus on managing the acute kidney injury with diuretics and fluid restriction, assuming the other symptoms are secondary to renal dysfunction, and postpone cardiac and respiratory assessments. The correct answer is C. Prioritize immediate intubation and mechanical ventilation to address the pulmonary edema, while deferring further cardiac and renal investigations until respiratory stability is achieved. Explanation. Scenario analysis. This scenario presents a clinically complex situation where a patient exhibits signs and symptoms suggestive of multi-organ system dysfunction. The challenge lies in differentiating primary organ failure from secondary effects, understanding the intricate interplay between organ systems, and prioritizing diagnostic and therapeutic interventions in a potentially rapidly deteriorating patient. The physician must integrate knowledge of pathophysiology across multiple organ systems to formulate an accurate differential diagnosis and management plan, all while adhering to the ethical and professional standards set by the Medical Council of Canada, MCC. Correct approach analysis. The correct approach involves a systematic and comprehensive assessment of the patient's presenting signs and symptoms, correlating them with the known pathophysiology of major organ systems. This includes understanding how a primary insult to one organ, e.g., sepsis affecting the cardiovascular system, can cascade and impact others, e.g., kidneys, lungs, central nervous system. The MCC's emphasis on evidence-based medicine and patient-centered care mandates a thorough diagnostic workup, guided by a strong understanding of disease processes. This approach ensures that the most likely underlying causes are investigated first, leading to timely and appropriate treatment, thereby upholding the physician's duty of care as outlined by MCC guidelines. Incorrect approach is analysis. An approach that focuses solely on a single organ system without considering its interconnectedness with others is flawed. For instance, treating only the respiratory symptoms without investigating potential cardiac or renal contributions would be a failure to apply comprehensive pathophysiological understanding, potentially leading to misdiagnoses and delayed or ineffective treatment. This contravenes MCC standards for thoroughness in patient assessment. Another incorrect approach would be to initiate broad, nonspecific treatments without a clear diagnostic hypothesis derived from pathophysiological principles. This lacks the precision required by MCC standards and can lead to iatrogenic harm or masking of the true underlying pathology. Finally, an approach that neglects to consider the patient's overall clinical picture and focuses only on isolated laboratory abnormalities without integrating them into the broader pathophysiological context is also professionally unacceptable. MCC guidelines emphasize holistic patient care, which requires synthesizing all available information. Professional reasoning. Professionals should employ a structured approach to patient assessment, starting with a detailed history and physical examination. This should be followed by the formulation of a differential diagnosis based on the pathophysiology of the major organ systems. Diagnostic investigations should then be ordered strategically to confirm or refute these hypotheses. Treatment should be guided by the confirmed diagnosis and the understanding of how interventions will impact the affected organ systems and the patient as a whole. Continuous reassessment and adaptation of the management plan based on the patient's response are crucial, aligning with the MCC's commitment to lifelong learning and quality improvement. Question 17. Strategic planning requires a physician to anticipate and manage the impact of a patient's altered physiological state on drug therapy. Considering a patient with significantly impaired renal function who requires a renally excreted antibiotic, what is the most appropriate approach to optimize therapeutic outcomes and minimize adverse effects? Option A. Administer the standard adult dose and monitor for signs of toxicity. Option B. Prescribe a lower dose than recommended for adults without specific pharmacokinetic justification. Option C. Rely solely on the patient's subjective report of feeling better or worse to guide dose adjustments. Option D. Consult pharmacokinetic data for the specific antibiotic and adjust the dose or dosing interval based on the patient's estimated renal clearance. The correct answer is A. Administer the standard adult dose and monitor for signs of toxicity. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a physician must optimize drug therapy for a patient with altered physiological parameters. The challenge lies in balancing the need for effective treatment with the potential for adverse drug events due to changes in drug absorption, distribution, metabolism, and excretion. Accurate pharmacokinetic and pharmacodynamic understanding is crucial to avoid under- or overdosing, which can lead to treatment failure or toxicity, respectively. The physician must consider the patient's specific condition and how it impacts drug handling and response, necessitating a nuanced, individualized approach rather than a one-size-fits-all strategy. Correct approach analysis. The correct approach involves a thorough assessment of the patient's specific pharmacokinetic and pharmacodynamic profile. This includes considering factors like renal and hepatic function, body composition, and the specific drug's properties. Based on this assessment, the physician should adjust the dosage and / or dosing interval to achieve therapeutic concentrations while minimizing toxicity. This aligns with the Medical Council of Canada's emphasis on evidence-based practice, patient-centered care, and the physician's responsibility to ensure safe and effective medication use. As outlined in their CertMedbry's roles, particularly as a medical expert and communicator, the goal is to optimize the therapeutic index for the individual patient. Incorrect approaches analysis. One incorrect approach would be to maintain the standard adult dosage without considering the patient's altered physiology. This fails to acknowledge the fundamental principles of pharmacokinetics and pharmacodynamics, potentially leading to subtherapeutic levels if absorption or clearance is increased, or toxic levels if clearance is decreased. This disregard for individual patient factors constitutes a failure in providing appropriate medical care and could be seen as a breach of the physician's duty of care. Another incorrect approach would be to arbitrarily reduce the dosage, without a clear rationale based on pharmacokinetic principles or observed clinical response. Caution is warranted. A random reduction might lead to subtherapeutic efficacy, prolonging illness and potentially leading to complications. This lacks the systematic, evidence-informed decision-making expected of a physician. A third incorrect approach would be to solely rely on patient self-reporting of symptoms without objective assessment of drug levels or clinical markers. While patient feedback is important, it must be integrated with objective data to make informed therapeutic decisions. Over-reliance on subjective reporting can lead to misinterpretation of symptoms and inappropriate treatment adjustments. Professional reasoning. When faced with a patient requiring medication, especially one with altered physiological parameters, a physician should employ a systematic decision-making process. This involves 1. Gathering comprehensive patient history, including comorbidities and current medications. 2. Performing a thorough physical examination. 3. Viewing relevant laboratory data, e.g., renal and hepatic function tests. 4. Consulting evidence-based guidelines and drug information resources to understand the drug's pharmacokinetic and pharmacodynamic profile. 5. Applying principles of pharmacokinetics and pharmacodynamics to predict the drug's behavior in the specific patient. 6. Developing an individualized treatment plan, including appropriate dosing and monitoring strategies. 7. Regularly reassessing the patient's response to therapy and adjusting as needed, integrating both objective and subjective data. This structured approach ensures that treatment is tailored to the individual, maximizing efficacy and minimizing risk, in accordance with professional standards and regulatory expectations. Question 18. Risk assessment procedures indicate that a 72-year-old male patient with a history of hypertension, type 2 diabetes mellitus, and chronic kidney disease, stage 3, presents with new-onset atrial fibrillation. He is currently taking ramipril, metformin, and atorvastatin. The physician is considering initiating a new medication to manage the atrial fibrillation. Which of the following considerations is most critical when selecting an anticoagulant for this patient? Option A. The anticoagulant's primary mechanism of action in inhibiting factor ZA or thrombin. Option B. The anticoagulant's ability to reduce the risk of stroke in patients with a CHA2DS2 VASC score of 3 or higher. Option C. The anticoagulant's potential for nephrotoxicity, given the patient's pre-existing kidney disease. Option D. The potential for the anticoagulant to interact with metformin, affecting glycemic control. The correct answer is D. The potential for the anticoagulant to interact with metformin, affecting glycemic control. Explanation. Scenario analysis. This scenario presents a common clinical challenge involving a patient with multiple comorbidities and a new symptom requiring pharmacotherapy. The professional challenge lies in selecting an appropriate medication that is both effective for the new condition and safe given the patient's existing medical history and current drug regimen. This requires a deep understanding of drug classifications, mechanisms of action, potential drug-drug interactions, and contraindications, all within the scope of Canadian medical practice. The physician must balance the immediate need to treat the new symptom with the long-term management of chronic conditions, avoiding iatrogenic harm. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's overall health status, including existing conditions and medications, before initiating treatment for the new symptom. This aligns with the principles of evidence-based medicine and patient-centered care, which are fundamental to Canadian medical practice as guided by the College of Physicians and Surgeons of Canada, CPSC standards, and the Medical Council of Canada, MCC learning objectives. Specifically, it requires the physician to 1. Identify the new symptom and its potential underlying causes. 2. Review the patient's complete medical history, including all diagnosed conditions and current medications, prescription, over-the-counter, and herbal supplements. 3. Consider the mechanisms of action of potential therapeutic agents for the new symptom. 4. Evaluate the potential for drug-drug interactions between new and existing medications, paying close attention to pharmacokinetic, absorption, distribution, metabolism, excretion, and pharmacodynamic additive, synergistic, or antagonistic effects, interactions. 5. Assess contraindications and precautions for each potential agent based on the patient's comorbidities. 6. Select a medication with a favorable risk-benefit profile, prioritizing agents with well-established safety and efficacy in similar patient populations. 7. Initiate therapy at the lowest effective dose and monitor for efficacy and adverse effects. This comprehensive approach ensures patient safety and optimizes therapeutic outcomes, reflecting the ethical and professional obligations of physicians in Canada. Incorrect approach is analysis. An incorrect approach would be to prioritize rapid symptom relief without a thorough assessment of the patient's existing medical profile. For example, selecting a medication based solely on its primary indication for the new symptom, without considering its interaction with existing medications or its impact on comorbidities, is a significant ethical and professional failure. This could lead to serious adverse drug events, exacerbation of existing conditions, or reduced efficacy of essential chronic disease medications. Such an approach would contravene the CPSC guidelines on professional conduct and the MCC's emphasis on safe and effective patient care. Another incorrect approach would be to rely on outdated or incomplete drug information. The practice of medicine, particularly pharmacotherapy, is dynamic. Physicians are obligated to stay current with drug information, including new warnings, contraindications, and interaction profiles. Failure to do so, and instead relying on memory or old formularies, can result in prescribing medications that are no longer considered first-line or are known to be unsafe in specific patient populations. This demonstrates a lack of due diligence and a failure to uphold the standard of care expected of Canadian physicians. A third incorrect approach might involve prescribing a medication with a complex mechanism of action that is poorly understood by the prescriber, leading to potential misuse or misinterpretation of its effects. While understanding every nuance of every drug is impossible, a physician must have a foundational grasp of the mechanism of action of any drug they prescribe to anticipate its effects and potential side effects, especially in a patient with multiple health issues. Prescribing off-label without a clear understanding of the rationale and potential risks would also be an unacceptable approach. Professional reasoning. When faced with a patient requiring pharmacotherapy, especially one with a complex medical history, a physician should employ a structured decision-making process. 1. Problem identification. Clearly define the new medical problem requiring treatment. 2. Information gathering. Obtain a comprehensive patient history including all current medications, allergies, and comorbidities. 3. Differential diagnosis if applicable. Consider potential causes of the new symptom. 4. Therapeutic options assessment. For each potential medication, evaluate its mechanism of action, efficacy, safety profile, contraindications, and potential drug interactions in the context of the individual patient. Utilize reliable, up-to-date drug information resources. 5. Risk-benefit analysis. Weigh the potential benefits of treatment against the risks of adverse events and drug interactions. 6. Patient consultation. Discuss treatment options, potential side effects, and monitoring plans with the patient. 7. Prescription and monitoring. Prescribe the chosen medication, initiate appropriate monitoring for efficacy and adverse effects, and be prepared to adjust therapy as needed. Question 19. The control framework reveals that a physician is managing a patient with multiple chronic conditions, each requiring different pharmacological interventions. During a routine follow-up, the physician notes a new symptom that could potentially be an adverse drug reaction or a drug-drug interaction from the patient's complex medication list. The physician must decide on the most appropriate course of action to ensure patient safety and optimal therapeutic outcomes, adhering to the Medical Council of Canada's standards for professional conduct and patient care. Which of the following approaches best reflects the expected professional judgment in this situation? Option A. Rely solely on the electronic health record's automated drug interaction alerts to identify the problematic medication and make a unilateral decision on the necessary changes. Option B. Immediately discontinue the most recently prescribed medication, assuming it is the cause of the new symptom, and advise the patient to monitor for improvement. Option C. Conduct a thorough review of all the patient's current medications, consult reliable drug interaction databases, assess the likelihood of the new symptom being an adverse drug reaction or interaction, and discuss potential management strategies, including medication adjustments or further investigations, with the patient. Option D. Continue the current medication regimen as prescribed, assuming the new symptom is unrelated to the medications, and schedule a follow-up appointment in 6 months. The correct answer is B. Immediately discontinue the most recently prescribed medication, assuming it is the cause of the new symptom, and advise the patient to monitor for improvement. Explanation. The control framework reveals that managing adverse drug reactions and interactions is a critical component of patient safety and professional responsibility within the Canadian healthcare system, as governed by the Medical Council of Canada's (MCC) standards. This scenario is professionally challenging because it requires a physician to balance immediate patient needs with long-term health outcomes, while adhering to established guidelines for drug management and patient communication. The physician must not only identify potential risks, but also proactively mitigate them, ensuring that the patient is fully informed and involved in their care decisions. The correct approach represents best professional practice because it prioritizes patient well-being and informed consent, aligning with the MCC's emphasis on ethical conduct and evidence-based medicine. This approach involves a thorough assessment of the patient's current medications, a comprehensive understanding of potential drug interactions and adverse effects, and clear, open communication with the patient about these risks and alternative management strategies. This proactive and collaborative method ensures that the patient's autonomy is respected and that treatment decisions are made in their best interest, minimizing harm and maximizing therapeutic benefit. An incorrect approach that involves simply continuing the current medication regimen without further investigation or discussion with the patient fails to meet the professional standard of care. This represents a regulatory and ethical failure because it neglects the physician's duty to monitor for and manage adverse drug events, potentially leading to patient harm. It also violates the principle of informed consent, as the patient is not made aware of the potential risks associated with their medication. Another incorrect approach, such as abruptly discontinuing a necessary medication without adequate consultation or alternative planning, could lead to withdrawal symptoms or a relapse of the underlying condition, demonstrating a failure to provide appropriate and continuous care. A third incorrect approach, such as relying solely on automated drug interaction alerts without clinical judgment or patient-specific context, can lead to unnecessary alarm or missed critical interactions, undermining the physician's role in personalized patient management. Professionals should employ a decision-making framework that begins with a comprehensive patient history, including all prescribed and over-the-counter medications, as well as relevant comorbidities and allergies. This should be followed by a systematic review of potential drug-food, and drug-disease interactions, utilizing reliable drug information resources. Crucially, this clinical assessment must be integrated with open and honest communication with the patient, discussing identified risks, benefits, and alternative treatment options, empowering them to participate in shared decision-making. Ongoing monitoring and reassessment of the patient's response to therapy are essential to ensure continued safety and efficacy. Question 20. Governance review demonstrates that during a patient encounter, a physician is attempting to gather a comprehensive history for a new patient presenting with vague abdominal discomfort. The patient appears visibly uncomfortable and hesitant when asked about their sexual history, stating, "I'd rather not talk about that." The physician needs to decide how to proceed to ensure an adequate history is obtained while respecting the patient's boundaries. Option A. Acknowledge the patient's discomfort, reassure them about the confidentiality of their medical information, and explain that understanding their sexual history can be important for a complete medical assessment, offering to discuss it further if they feel more comfortable or at a later time. Option B. Make a note in the chart that the patient is unwilling to discuss their sexual history and proceed with the rest of the physical examination without further attempt to gather this information. Option C. Accept the patient's statement at face value and move on to other aspects of the history without further inquiry into their sexual history, assuming it is not relevant. Option D. Persist in asking detailed questions about their sexual history, emphasizing that this information is critical and that the physician cannot provide adequate care without it, regardless of the patient's discomfort. The correct answer is A. Acknowledge the patient's discomfort, reassure them about the confidentiality of their medical information, and explain that understanding their sexual history can be important for a complete medical assessment, offering to discuss it further if they feel more comfortable or at a later time. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent tension between a physician's duty to obtain a comprehensive patient history and the patient's right to privacy and autonomy. The physician must navigate the patient's reluctance to disclose sensitive information, which could be crucial for accurate diagnosis and treatment, while respecting their boundaries and avoiding coercion. The physician's judgment is required to balance thoroughness with sensitivity and to ensure the patient feels safe and understood. Correct approach analysis. The correct approach exemplifies best professional practice by prioritizing open communication, empathy, and patient-centered care, aligning with the ethical principles and professional standards expected of physicians in Canada. Specifically, it reflects the College of Physicians and Surgeons of Ontario, CISO guidelines on professional conduct, which emphasize the importance of building trust and rapport with patients. By acknowledging the patient's discomfort and offering reassurance about confidentiality, the physician demonstrates respect for patient autonomy and privacy, as mandated by provincial medical regulatory authorities. This approach fosters an environment where the patient is more likely to share relevant information voluntarily, leading to a more accurate and effective medical assessment. The physician's willingness to adapt their approach based on the patient's cues is also a hallmark of good clinical judgment. Incorrect approaches analysis. One incorrect approach fails by being overly persistent and dismissive of the patient's expressed discomfort. This disregards the patient's right to privacy and autonomy, potentially violating principles outlined in the Canadian Medical Association (CMA) Code of Ethics, which stresses the importance of respecting patient wishes and avoiding undue pressure. Such an approach can erode trust, leading the patient to withhold vital information, thereby compromising patient safety and the quality of care. Another incorrect approach is to accept the patient's limited disclosure without further exploration, even when it is clear that critical information is being omitted. This falls short of the physician's professional obligation to conduct a thorough history, which is essential for accurate diagnosis and management. Provincial medical regulatory bodies expect physicians to make reasonable efforts to obtain necessary information while respecting patient boundaries. Failing to probe further, even gently, can lead to diagnostic errors and suboptimal treatment plans, contravening the standard of care. Third incorrect approach involves making assumptions about the reasons for the patient's reticence without seeking clarification. This can lead to misinterpretations and a failure to address the actual barriers to disclosure. Professional standards require physicians to actively listen and seek to understand the patient's perspective, rather than projecting their own assumptions. This can also be perceived as judgmental, further alienating the patient and hindering the therapeutic relationship. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and empathetic acknowledgement of the patient's concerns. When faced with reluctance to disclose sensitive information, the physician should first validate the patient's feelings and reassure them about confidentiality. If the patient remains hesitant, the physician should explain, in clear and non-judgmental terms, why the information is medically important for their care. The physician should then offer alternative ways to obtain the information, such as focusing on specific symptoms or offering to discuss sensitive topics at a later time if the patient feels more comfortable. Throughout this process, the physician must continuously assess the patient's comfort level and be prepared to adjust their strategy, always prioritizing the patient's well-being and autonomy. This iterative process of communication, reassurance, and adaptation is crucial for effective patient history taking within the Canadian regulatory and ethical landscape.